It's with great pleasure I introduce one of my colleagues, Dr. Mungapati.
That's
Thank
right,
you.
yeah.
Talking about depression.
Okay, then, yeah, good afternoon, everybody. I work at Northgate Hospital. I'm a psychiatrist there, working with the older people service at the moment. Thank you for coming. Today, this afternoon, I'm going to talk about depression. You may all know a little bit about that. It is about discussing how one feels when they are depressed, and also what is out there and what helps, and how we can help ourselves, and if we are caring for somebody or looking after for someone who is depressed, what sort of advice or what help we can offer them. So before I begin the presentation, I just want to let you know, make a few points about changes in the mood. We all react to our environment and what happens in our day-to-day lives, and the mood changes with those experiences, and that is fairly normal. Sometimes we feel fed up or miserable and sad, but those feelings, they don't last for very long, and they do not interfere with our lives. Sometimes there is the reason, and sometimes there isn't a reason for that, but we usually cope. We talk to our friends or family, and we just and things change, and we may feel back to our normal self again. But in depression, those feelings, they don't lift, and they carry on for weeks or months, and that is bad for us because it is going to affect how we feel. We may not enjoy the things we do and interfere with our lives and with work. These are the symptoms of depression, and we may not experience all of those things, but sometimes it could be as few as 5 or 6 symptoms when somebody is depressed, and sometimes it could be more. It may start with a mood change, like you may feel down, especially in the mornings, may not want to get up, lose interest in things what you usually do or enjoy, and find it difficult to cope or take decisions which affects our lives. Feeling tired, resting in bed during the daytime, or feeling hopeless, not feeling refreshed even though sleeping for several hours at night, and loss of appetite leading to weight loss sometimes, and losing confidence, feeling inadequate, and avoiding people, and sometimes it can get worse. People can have thoughts to harm themselves as well, and think of ways to do that. These things happen when somebody is depressed, and this persistent low mood which is there for a period of time. And it is difficult sometimes to realize that for the person that they are depressed, they may start to blame themselves, that they are either lazy or not having the willpower to do things because they're struggling. Sometimes a friend or a partner or a family member may actually talk about those things and say that okay, you might need some help, that it looks like something is not right here. I did discuss all these symptoms, but sometimes it may start with feeling a headache or aches and pains and sleep disturbance. These are some of the physical effects of depression, physical illnesses causing those problems, and sometimes depression can begin that way as well. We all feel disappointed and frustrated, but those feelings may not last long, and things can get better. But in depression, it carries on, and especially for a long period of time, especially after losing a job or following a bereavement. or a divorce. Those sort of life events can make one feel depressed, and things that happen in our life, those life events, and also the circumstances where we live in, being single or being lonely, and feeling stressed and not able to deal with the worries, having physical problems, they can all cause or lead to depression. For example, physical illnesses, long-term physical illnesses I'm talking about, like heart disease or underactive thyroid or flu, sometimes flu which doesn't get better, can also cause, can also make people depressed. And sometimes some people are a bit more vulnerable than others, depending on our genes, our personality, or our life experiences, early life experiences. And substances like alcohol and cannabis, they are not going to help either. Regular drinking of alcohol can make depression, can lead to depression, can make depression worse. Unfortunately, depression is more common in women than man, and one of the reasons may be because women do work and also have to look after the family, children, for example. Those are all the causes for depression. And you might have heard that people who feel depressed or who suffer from depression can also experience excessive happiness, or can be overactive at times. It does happen in 1 in 10 people who suffer from depression, and that is called bipolar illness, or in the past it was called as manic depression. So that is briefly about depression. And then when if we are feeling depressed, or if if a family member or a friend is feeling depressed, what do we do about that? Sometimes we talk about our problems. That may help, and sometimes you may have to speak to your GP or your doctor about the change in the mood pattern, and discuss what help is available. But we can also help ourselves by doing things like having regular exercise. It can be difficult, but just going out for walks, as simple as that, things like that, and doing few things in the house which we all enjoy, or the things we enjoy, and having a routine will also help people who are suffering from depression. A good diet will help, especially, as I said earlier, people who are depressed, they may not eat very well, and that can make the mood worse. So trying to eat regularly can help, and avoiding alcohol. The alcohol itself can make the physical health worse, and also it may stop us from actually dealing with the problem in the first place. And cannabis use in teenagers especially, there is recent evidence that it can bring on depression. And sleep, as I said, sleep is disturbed in depression, but without worrying about that, if one can relax by listening to music or watching television and let the body rest, if you keep yourself occupied, distracted, then eventually one may fall asleep, and that can help. And if we know the cause for depression, as I said earlier, sometimes we don't know what are the causes for depression. It can be the case. Then it's writing down the problem and trying to deal with it can help. People who suffer from depression will eventually come out of that, and it is having a positive frame of mind, trying to resolve the problem, at helping themselves, all these things can help. But also by discussing with the GP and finding out what help is available. GP can suggest after an assessment, depending on the circumstances and the severity of the depression and the symptoms, go through various things like self-help, helping themselves. Also, there are talking treatments available, psychotherapy, and finally antidepressant medication. I'm not going to talk a lot about antidepressants because Professor Bazir is here. He is going to talk a little bit later about the tablets that is which help people who are depressed. But here we are looking at mainly self-help and talking therapies. Self-help is mainly based on information leaflets and books on CBT principles. And also there are computer programs and programs that one can do on the internet. And exercise, as I said earlier, but the GP can refer to an exercise program which is I think twice or once or a week for about 10 to 12 weeks. That can also help. It's always, it can be difficult sometimes talking to a family member or a close friend about our feelings when we are depressed. And in a situation like that, talking to a trained therapist always helps. One can discuss about their problems and get the relief by getting the things off their chest. Most surgeries, or some surgeries at least, have counselors attached to the working there, or GP can refer the person to the local counseling service. CBT is a form of psychotherapy, talking therapy, and it can help people by identifying unrealistic and unhelpful ways of thinking, which sometimes can be the cause for depression. And by changing our thinking, the depression can be resolved. And also trying to solve the problems, breaking the problem, a bigger problem, into a more manageable bits and developing the problem solving skills. Relationship problems. There an organization called Relate can help couples with relationship difficulties, and support groups are there for people who are disabled or who are caring for a person who is depressed. At those self-help group sessions, people can share their experiences and benefit from that. A death of a loved one can lead to depression, and grief is, we all go through the natural grief experience, but some people become depressed following that, and in a situation like that, there are specialist bereavement counselors available if the person would like to discuss about the death of a loved one. And there are other forms of therapy, interpersonal and psychodynamic psychotherapy, which those are for people who have long-standing difficulties in their lives or with relationships. But there are some problems with talking therapies. These therapies can bring out unwanted effects. They can have unwanted effects. They can bring those bad memories, which may not be bothering the person at the moment, and can make one feel worse for a while. But also the person will come out stronger after the therapy. and it may change their outlook towards their relationships, friends and families. In the beginning, it may put some strain on those relationships. But make sure you trust your therapist. If you have any concerns, then either discuss that with the therapist or with the doctor. Usually these tablets are recommended if depression goes on for a long period of time. So how do they help? They help in lifting the mood and making one feel less anxious and agitated, thereby helping the person to cope better and resolving their difficulties. After a few days, you may notice a change in your sleep pattern and may feel less anxious. The antidepressants work by boosting the chemical messengers in the brain called serotonin and noradrenaline. There are a number of chemical messengers in the brain, like there are several different chemical messengers in the brain, but these particularly two are thought to be low when one is depressed in certain parts of the brain. So the antidepressants will boost the function of those parts of the brain that use the serotonin and noradrenaline. The chemical messengers are necessary for transmit messages from various, there are millions of cells in the brain. So they help in transmitting the messages from one cell to another. These antidepressants, like any other medication, can cause a few side effects, but they are usually mild and they may not last for very long. Some of them can make you feel sick for a few days or anxious for a brief period of time, and others can cause dry mouth or constipation. But you can get a lot more information from your GP or from the pharmacist. Some of these antidepressants can make you feel sleepy. It's better to take them if that is the case, better to take them at night. But however, if you're feeling sleepy during the day, it's better to avoid working with machinery until that effect wears off, and try to avoid alcohol because it can increase the sedative effect of the antidepressant. Usually it is the GP who prescribes the antidepressants. And how long one needs to take the antidepressant? About 6 months once the symptoms are resolved. But people who experience depression, they may have another episode of depression as well. So in circumstances like that, maybe one has to stay on the medication for a longer time. The antidepressants are not addictive. We don't have to keep increasing the dose to have the effect, but they can cause some withdrawal symptoms if they are suddenly stopped. Those symptoms could be nightmares, vivid dreams, or anxiety or diarrhea. And what about use of antidepressants in young people? This is usually done by the psychiatrist, and very few tablets are licensed to use. One is the fluoxetine, which is a newer form of antidepressant, and usually when young people are prescribed antidepressants, they also receive some form of counseling or therapy, and usually they are monitored weekly by the mental health services. And there are other forms, alternative remedies. like you may have heard St. John's wort. It's not commonly used in this country, but in countries like Germany, people do use that medication. The reason for it is always good to discuss with your doctor about using medication like that, because it can interfere with other tablets if you are using other medication for other physical health problems. So, having discussed the talking therapies and the medication, you may have the doubt or not clear what is best for you. Usually in mild form of depression, antidepressants are not recommended. So the talking therapies, if problem remains, and seeing a counselor or receiving psychotherapy. But if the depression has gone on for a long time and it is affecting the person badly, if you're not able to enjoy or not able to go to work, then antidepressants, you can consider using antidepressants. In moderate form of depression, both psychotherapy and antidepressants are effective. But in severe forms of depression, antidepressants seem to have an advantage over talking therapies. So the antidepressants may work better for somebody who is severely depressed. But again, we have a choice. Having said all that, some people may like to take tablets, some don't, and would like to talk about their difficulties. And what about seeing a psychiatrist? Most people get the treatment from their GP. But certain forms of depression, if it has gone on for a long period of time, the GP may refer to the local mental health team, and you may see a psychiatrist. He or she may discuss the various treatment options available after a thorough assessment, and the treatment may involve again antidepressants, psychotherapy, or some practical help, or even involving the family members. And finally, about hospital admission, very few people need to go into hospital. I think according to statistics, 1 in 100 people who suffer from depression would need at some point in their life an admission to the hospital. And what other treatments are available for somebody who is severely depressed or suffering from moderate depression that is not getting any better? You might have heard about ECT, which is passing an electric current, and it is usually done in the hospital under general anesthesia. But that is not it is not often used anymore. So in very rare circumstances, like when people are severely depressed and are at risk of their life, and where treatment is necessary as an emergency basis. And finally, I would like to discuss quickly about how we can help someone who is depressed. The first thing to do is, even though it is very difficult, listening to their problems. We have to give the person who is depressed the opportunity to talk about their difficulties. Try not to give any advice until one is asked for, but it will be helpful to help them find a solution for their problems and deal with their difficulties. Try to reassure them, because the person who is depressed may not believe that they can come through this. Make sure that they are eating well, but do not discourage them from taking medication or seeing a counselor or a therapist. If you have any worries about their treatment, discuss with the doctor. Thank you.